Central nervous system pathology, developmental anomalies, neural tube defects arise from incomplete closure of the neural tube. Neural plate invaginates early in gestation to form the neural tube, which runs along the cranial caudal axis of the embryo. The wall of the neural tube forms central nervous system tissue. The hollow lumen forms the ventricles and spinal cord canal, and the neural crest forms the peripheral nervous system, associated with low folate levels prior to conception, detected during prenatal care by elevated alpha-fetoprotein levels in the amniotic fluid and maternal blood. Anencephaly is absence of the skull and brain, disruption of the cranial end of the neural tube. Leads to a frog-like appearance of the fetus. Results in maternal polyhydramnios since fetal swallowing of the amniotic fluid is impaired. Spina bifida is failure of the posterior vertebral arch to close, resulting in a vertebral defect, disruption of the caudal end of the neural tube. Spina bifida oculata presents as a dimple or patch of hair overlying the vertebral defect. Spina bifida presents with cystic protrusion of the underlying tissue through the vertebral defect. Meningeocele, protrusion of meninges. Meningeomyocele, protrusion of meninges and spinal cord. Number 2. Cerebral aqueduct stenosis. Congenital stenosis of the channel that drains CSF cerebrospinal fluid from the third ventricle into the fourth ventricle, leads to accumulation of CSF in the ventricular space. Most common cause of hydrocephalus in newborns. CSF is produced by the choroid plexus lining the ventricles, flows from the lateral ventricles into the third ventricle through the interventricular foramen of Monro, flows from the third ventricle into the fourth ventricle through the cerebral aqueduct, flows from the fourth ventricle into the subarachnoid space through the foramina of Magendie and Luschka, presents with the enlarging head circumference due to dilatation of the ventricles. Cranial suture lines are not fused. Number 3. Dandy-Walker malformation. Congenital failure of the cerebellar vermis to develop, presents as a massively dilated fourth ventricle, posterior fossa, with an absent cerebellum, often accompanied by hydrocephalus. Number 4. Arnold-Chiari malformation type 2. Congenital extension of cerebellar tonsils through the foramen magnum. Obstruction of CSF flow can result in hydrocephalus. May occur in association with meningeomyocele and syringomyelia. Spinal cord lesions. Number 1. Syringomyelia. Cystic degeneration of the spine.